Hello, everybody. This is episode 24th of The Health Show. I'm super excited. I'm super passionate about this episode because I'm going to be joined in by Dr. Kamran Iqbal. Um, Dr. Kamran Iqbal is an amalgam of passion, zest, and zeal. And not only that, he has a huge range of experiences under his belt. I mean, I cannot fathom the amount of experiences that he has, the amount of things that he do, how does he multitask, how is he so productive, how is he's so creative in doing all these sorts of things. So I'm going to ask him every single thing. I'm going to ask him exactly what he does, how he does it, and how can people learn from his experiences, how can people learn to stay creative, to stay productive, to be at their best every single day, being consistent about it. And not just that, leadership, it's a huge part of his experience. So hello, Dr. Kamran, how are you?
Hi, how are you? Are you able to hear me clearly?
Yeah, you're audible. It's all good.
Great, great. How are you doing?
I'm doing great. Thank you so much for joining in. This is a pleasure indeed.
Likewise, thank you for having me, inviting me here. It's my first Instagram-based, in a way, interview or conversation. Right? It feels good. Now we use this technology. Thanks to you, I'm getting to learn the new things from you. Yeah, really. Thank
That's
you.
great. That's great. Thank you for joining in. So let's begin. First of all, Dr. Kamran, I want to ask, who is Kamran Iqbal? I mean, this whole person that we see right now in front of me, you have a vast experience under your belt. You have, you're a part of so many things. I mean, how do you do it? I cannot fathom. But I want to ask you about it. I want to know what is your inspiration, what keeps you going, and what are you all about?
So, if I want to define it a bit, one does not get to answer or ask these questions to oneself. But I'm very glad that we are having this conversation. So my life is largely me as a person. Then I talk about what I'm all about. So my life is largely about creating value and impact for other people, right? Because having trained in healthcare, even before getting trained into healthcare, I was involved in activities which had to do with empowering people. As a matter of fact, it motivates me more when I get a chance to be in a situation or a position where I can impact lives, either empowering them or be able to share my experience. Like right now, I feel empowered because of the question that you're going to ask, right? So it starts from very basic, right? And that from that it becomes a cycle, a sort of momentum, right? This is and I think through healthcare, I guess I was able to find a more structured way of creating impact. My calling is a strategic approach in changing lives. It is related to healthcare and beyond as well, right? So this has been the case. And largely speaking, what were the driver? I think creativity, innovation, and change were the driver, right? This drives me. Whenever I get an opportunity, I'm a little curious kind. So whenever I get the opportunity to create some change, I just get into it. There are times when one can think later on. One can take the action right away, and then you can decide. It's just like it is like whitewater rafting sometimes. So you just have to jump in to navigate at times. So not all the moves are planned, but you try to plan as much as possible. That's how it works. So this is about what drives me and what all I am about. And as a person, I'm INFP on MBTI scale. Introvert, intuitive, feeling and perceiving, who happen to balance himself over a period of time. After meeting a crowd of people or a number of people, I need a breather to kind of realign my energies and get back to my zone. So I balance it over time. I'm not a classical introvert, but but there is a part of me that helps me. I like being myself. This is my room, my box. Like being myself on the weekend with them, right? So this is me, you know. Yeah, yeah,
That's just great. And seeing that you have a love of books, that's also great. My second question is everything that you do. I mean, tell us about your vast experiences with the World Bank, World Economic
yeah,
Forum, Global Shapers
yeah,
Karachi Hub, Pakistan Digital Health Initiative, Sindh
yeah,
Healthcare Commission. You being a CEO of GSIH. Sina Healthcare, the Human Voice Initiative. Like, I need to take a break before I continue with all the things that you do. But let's just keep going to the end. So the Human Voice Initiative, International Label Organization, Ad Consult, all in all, by being a doctor graduated from Zauddin University. Please
yeah.
entail all the learnings that you've developed from each of these experiences so our viewers
Yeah.
can grab a lot of value from your life. So I want you to go in depth with each and every single experience of yours.
Yeah. I think I take it as an opportunity to share a bit of part of my life story here. So when I was a kid, I'll tell you this interesting stuff. When I was a kid, way back, I'm like, I turned 40, I'm 42. Right? So when I was a kid, so back in those days, there was no internet. And I'm talking about early 80s, right? There was no internet, there was no mobile phone. Life was simple, right? My dad was quite disciplined person, actually. And quite of a credit goes to him quite a lot in my bringing up. He always nurtured creativity, and he himself was a creative person. Besides being a journalist, turned into advertising, but his calling was creative. So he understood deeply the importance of creativity. So when I was a kid, we used to get like number of newspaper at my father's office or at home. So we have five brothers and sisters. Right? I'm the second last in terms of younger siblings. So my duty, everyone's duty was divided at home. So my eldest sister, her duty was to keep the drawing room, in prim and proper condition. The younger sister had different responsibilities. My elder brother had a responsibility to maintain all the communications related material with my father. So my duty was to do clipping, right? My father used to mark all this article early in the morning, all this news item as well as article. My job was daily to get when I used to get up after breakfast early in the morning. My job was to do the clipping before going to school, right? While I used to do the clipping of the news, I used to read all the news, right? Imagine a small kid trying to do some clipping. He has read all the news every day for many, many years, right? So ultimately, I ended up having a relatively more information than my colleagues, my siblings. So that helped me a
Way
lot.
too,
It's
way
like
too much.
So my mom used to tell me, Kamran, it just takes like 5 minutes for this, but why you take an hour, right? So I used to, but this was all curiosity. So I used to go by curiosity, like what's happening around the world. So my first love affair as an academic was actually foreign affairs. I wanted to go to PSS, get into foreign service, but then I realized that it is going to be good, but there is more to life than that. There are other ways to perhaps expand, right? So, but that stayed with me, right? So when in my summer vacation, my dad used to tell us, all of us, that every day I want each of you write a essay. He used to give the topic, and we used to give him the essay because he was a literary person and he liked that. Oh, right? He used to take us to a lot of art exhibitions, mushaira, and all those kind of stuff. So we used to enjoy a lot together. So I always used to have a better point comparingly, given a number of dots to connect more naturally, and it kind of accumulated over time. And let me tell you a funny incident. So, back in those days, there was only PTV, and there was this in everyday newspaper. There was a small telecast of PTV about what
Exactly.
show at what time, those kind of stuff. I always used to cut it off and put it in my pocket. So anyone used to ask in my home, I used to present it that this is what the program for today is.
Wow.
I still remember that. It's kind of funny, right? So, but over the period, it kind of helped me. So I became more curious, and my father helped me with that curiosity. So that was my the early childhood phase, and it was really good, right? And when I was in my college, the first workshop I attended was Stephen Covey's. Actually, that changed my life. Actually, he himself wasn't
Wow.
there, but there was this organization called Sensei by Umar Khan and Nazir Khan Zahid. Right back in those days, I did my 1996. I did my first NLP course, 1996. I was a kid, right?
Wow. What was your age back then?
You can count. You can count it. 1978 is my date of birth. 78, 80, I was almost nearing 20. 18.
Wow.
Yeah. So I attended that, and right after I attended this Seven Habits workshop. Not just myself, all of my siblings attended. My father, made sure that we all attended it. So, and we started applying it. I mean, there was a discussion every day in my home. So after at 9 p.m., we all there was a ritual, family ritual, that we all have to be really present at 9 p.m. sharp at the dinner table when the news is on the TV. So everyone, we used to eat with our dad and mom, right? And we used to have a discussion about what's happening in the country, what's happening in the world. So my father used to ask all of us that if you were the prime minister of this country, what change you are going to bring? And this was a fairly frequent question, right? So we used to debate on that table. That that kind of intellectually stimulated us early in days. So that drive he kind of nurtured, it stayed with us for long. The confidence, the drive he nurtured in us. So I often suggest now that I have two kids, I often try to replicate it. Right? These kids have more information than I could ever have in my childhood. Right? Look at YouTube, Instagram, you name it. Right? Whole online courses, right? So they are luckier, I would say. And if we nurture those kind of some disciplines, this is certainly going to help. So this is how I entered. With this background, I entered into my medical college. My entry into medical college was slightly different, not in the sense of admission, in the sense that the background I was coming up with, right? So that kind of gave me advantage. So I had little better, I would say, relatively better awareness about my surroundings and what's happening in Pakistan and the world before entering there. Also, I used to work in my dad's office during summer vacation. So my first job was technically, and this is a joke that you will laugh at it. So once I was sitting in my dad's office, one of his clients called. He used to have his own advertisement. So I picked up the phone and said, "Yo, hello, what's up?" He said, "Wait a minute, let me talk to the client." He talked to the client, then he said, you are going to go to the reception. You're going to sit there for this June in your summer vacation as a reception. I'm going to give you pay till you learn how to talk on the phone.
Wow.
And he sent this guy on for 1 month vacation. So छुट्टी करो और ये बैठेगा मेरा बच्चा यहाँ पे. So it was an ego thrashing experience, and it kind of helped. Right? I learned how to talk on phone. Then my second job was with the finance guy, right? Accounting, right? Learning about it. Then I got busy into stuff that he was occupied in, right? So I got a little bit of exposure, not real experience, in terms of working exposure in my father's office. All of our siblings got it, not just me. All of my cousins had it too, right? So then I joined my medical college, Saudi, right? And it has been a amazing experience. Their teachers, we were lucky. We were the first initial batches of Saudi. I was batch 4. And there were a lot of new experimentation in medical education they were doing for a competitive advantage, and we were the beneficiary of that, I would say. Problem-based learning started with us. Even before Aga Khan embraced PBL, we had already embraced PBL. Almost around 40% of our studies back in those days were PBLs, problem-based learning. So this kind of also helped. right? So also what motivated me in my college days was an incident. There's a book called Harrison's Principles of Internal Medicine. This is called Bible of Medicine, right? And there was this chapter in cardiovascular physiology, pathophysiology of cardiovascular disease, in which there was a mechanism of action of the detoxification factor. And I was reading through it, and I found a mistake that the mechanism of action was wrong. So, काफी डरते I was like, I wrote a letter to the author of Harrison that this is a mistake from a student who's known from a medical college, not known by the world back in those days, and here's a mistake. In Pakistan, actually. so he wrote me back. I did not know who was this guy. This guy was a vice president Howard Medical School, right? Dr. Eugene Braunwald. He was a pioneer in cardiac catheterization. He was kind enough to invite me for internship, and he appreciated that. And that letter kind of roamed around that Dowdin a lot, and kind of a bit of a claim to fame, and I kind of bragged about it a lot in my medical college days. And gave me a lot of confidence, actually, on academic care, right? And little I knew that I would be working with them after like almost 16, 17 years, you know. So that is...
You had no idea.
I had no idea. I wanted to always, like, it's one of the best, obviously, universities out there. Who wouldn't want to? But I didn't have thought it that way, you know. But if I did visualize it. I would admit to that when in my medical college, I did visualize it. Yeah.
Sorry to touch you, but what I don't understand is how, obviously you're visualizing to be a doctor in your future as well. How did a doctor graduated from Ziauddin, is a part of so many other things like the World Bank, the World Economic Forum, Global Savers? How did that happen?
So what really happened when I was doing my house job, it's when my father passed away, and his death was right in front of our eyes. He was admitted in the same ICU I was working in. So I was kind of a very frustrated from the healthcare system, trust me, because when you see yourself as a doctor, right? And one of the first doctor in our family, technically speaking. Then my younger sister also became a doctor, so she was second in my family, in our immediate family, to become a doctor. So there was a lot of expectations from yourself, right? Your ability, your ego, I would say, your ego as well, that I can do this, that, and everything, ambitious types, right? Type A personality, classical ambitious ones. So I was the type, right? And I just wanted to move mountains to really bring that back. But you see, I saw firsthand the frustration of not being able to do good. Not because the healthcare system wasn't there, just because the healthcare system was inadequate to address, healthcare. As a matter of fact, timely, it cannot address timely. Also, I started hating the fact that you're treating one patient at a time and hoping that the world would change. For me, it's a great fallacy, right? It may help the patient, but at the end of the day, it is not helping the healthcare system. You know what I mean? Right? So that was a change. That's when I started requesting some people who could be my mentor. So one of my mentors, Dr. Faiz Bora, these days he's a president of American Thoracic Society, the cardiothoracic surgeon, and he was heading the New York Presbyterian Hospital's cardiothoracic surgery. And, he was associated with Columbia School of Surgeons back then. So I asked him for the advice. He said, Kamran, you take a break and then you decide what you want to do in life. Because you just can't go back to the same mindset again. It has changed you a lot. So I took a break, and that break was not just 1 year or 2 years. Break turned out to be 4 years long, right? So I was lucky enough to be taken as a student. It was a job, but it was also a student by not doctor, but Imran Mir. He's one of the founders of Indus Art Valley. right? My father's background was advertising. So we had all the team. I wanted a break from healthcare completely, really. So I worked with him. I have been a creative side of advertising, right? And we have done we did a number of successful campaigns with him. I learned firsthand what exactly brand is all about, what exactly advertising is all about. Right? It was one of the wonderful creative years that I get to spend with them. That's when I was working with Food Cone and Welding. It was advertising agency. It was the American advertising agency. Imran Mir passed away. Imran Mir was a student of this uh, this graphic design giant who made this "I Love New York" campaign. The guy who originated that. He's a renowned artist. So anyway, so from there, I didn't stop. Then I got offer at Aga Khan Health Service, Pakistan. I joined there as a head of marketing, communication, resource mobilization. Then worked with their quality team.
So sorry, I'm cutting in between. While you were doing all these experiences, so you had left medicine all along, whether you have left it there, you've taken a long break.
It wasn't really. There were 2 years in which I had completely left. For the later 2 year, I was going to I started going to the hospital in the afternoon, in the evening time.
Right.
So I used to go to ICU of Ziadi just to rebrush my skin after hatches of 2 years. Really trying to think whether to do USMLE and just like everyone else go out of the country and just practice like all the doctors. Right. So but then I chose an alternative path, which was more like creativity. I could do something for myself. Then I joined Aga Khan Health Service. There I got a really good experience as a head of marketing communication from 2013 to 2015. And then I joined Green Star Social Marketing as the AGM. I was looking at the advocacy application. Then almost 2 years, we with a friend of mine, we did a stint of our own technology company. We were into mobile app, mobile game, 3D animation. We had some US-based clientels, right? We did that. Then we tried doing it successfully, but not all the startup ended with success. That was important learning, I would say. It was so important that it was a steep learning curve, but I learned a lot from that. From there, I got an offer from Sinha Healthcare. So I joined there as a chief operating officer. Sinha Healthcare was one of the largest private primary healthcare organization, not for profit. They have around 30 clinics. So when I joined Sinha, they had 13 clinics and 250 people. And they should treat around 250,000 people annually. So I joined them in 2016. When I was leaving them 2019. So we have turned around and took them from 13 clinics to 30 clinics on brick and mortar, from 250,000 patients to almost 1 million patients in a year, and 500 people, and almost $3 million budget. Right, so we did a lot of turnaround, and that was basically possible. And I was lucky enough to be a bit pushy, right, to create my team over there. Right, one has to be. So, the change does not come passively. This is how I got it. So World Bank had been watching the stuff that I was doing. Right, while with Aga Khan, I started with Global Social Innovation Hub. Right, so idea was to bring all the social innovators together. Right, and this has been going on. I'm not actively there with that platform as much, but I'm more actively with other platforms that we created. I also did work with ILO. I helped set up their Young Entrepreneur Network. This is a marketplace, right? And during that time, it was side activity. I worked the full time, but I kind of curated it over the period of time. And after that, when I joined, then after Sinha, I joined World Bank. I'm working there, working there as a consultant, public-private partnership. So my area is to create a public-private partnership dialogue platform, because globally, healthcare is seeing a devolution from a government sector to the private sector. So we bring sense and structure to it by bringing private parties and government together on one table to solve the problem. So help public-private partnership.
So like how? What do you think? What got you into World Bank? Like how you had a like medical background, but what
Yeah.
was that specifically? What was those things that got you into World Bank?
So the thing was that when I was working with Sinha, someone I knew, he was ex-director of Sindh Healthcare Reform Commission, right? He reached out to me. He was working for public-private partnership with the World Bank. He was an ex-director of public-private partnership with the government. He reached out to me for interviews because we had become one of the largest stakeholder in primary healthcare in Karachi, as a matter of fact. So government of Sindh was eyeing opportunities for partnership, who they should partner with primary healthcare. And the World Bank was helping them cope. The idea
All right.
of the World Bank was to create a partnership dialogue platform for this, right? And they wanted people who are already very well connected to successfully run the public-private partnership dialogue platform. So the whole idea is to start from the dialogue platform, gather learning, and from that learning to take public-private partnership to a performance-based contract. So that's when I met them, and they kind of figured out that I was fairly connected with all the healthcare sector and fairly connected with the ongoing partnership. There was a level of credibility and trust that I enjoyed from multiple stakeholders. They thought of me as a middle person who can bridge World Bank between the government and the private. This is how it all came about. So after joining the World Bank, I started getting some real experience of the partnership, I would say. But the World Bank, I would say, my knowledge was there. It was more theoretical, right? I started gaining it once I joined the World Bank. So this is how it is. It's been almost, it's going to be more than a year in this October, right? Since I've been working with, and it has been an amazing experience. So we have been successfully able to bring all the chief decision makers, all the big top private hospital, not-for-profit organizations, and the top decision maker from the government on one table. So far, we have conducted like three of series of public-private partnership dialogue platform meetings. So this August is going to be late part of August. We are planning for the fourth. Let's see how it all turns about. This time it's going to be about COVID pandemic. So because of this platform, in this pandemic, not just only because of this platform, because of the overall public-private partnership engagement activity, government of Sindh and the private sector have become too much closer, so such that it has really helped Sindh fight against COVID-19. Right? We started before COVID-19, and the COVID-19 we have seen exemplary partnership in public-private partnership, which is completely different from the federal government. This is why in federal things are still in silos, but in government of Sindh, partnership is really taking the right direction. So this is with the World Bank. And while I was working last year with the World Bank, World Economic Forum, I was having a conversation with the World Economic Forum. That's where I was getting also interviewed for head of healthcare assistant over there for position in Geneva, right? That's when somebody recommended me, hey, Kamran, why don't you take a look at Global Shapers Hub? This is when I connected to that. Then I started looking into it. They started sharing some ideas, some exchange of things. I connected to a number of Indian friends over there from across the border. We're working with the World Economic Forum. Pakistani people serving higher up in the World Economic Forum, and they wanted to do something in Pakistan. So my articulation was very clear, given that I'm majorly in Karachi. So I could exercise some sort of influence to bring change in Karachi. That became a pivot point for World Economic Forum engagement, and they asked me to become founder curator of Global Shapers Club Karachi. So Alhamdulillah, it is a second year now. I'm a founder curator for life, and right now this is second curator we have elected. His name is Sikandar Zinjo, and vice curator Sohaib. Sohaib, they both are brilliant individuals. With them are a team of global shapers, really doing amazing stuff. With the global shapers, we try to impact locally with a global vision. So we are aligned with World Economic Forum. So global shapers have gives me like lifetime access to all the World Economic Forum activities, by the way. So this is not so short journey in terms of number of destination I've been to in between. Yeah.
You know, Dr. Kamran, I'm still in awe of, the kind of things that you've done, the kind of vast experiences. But the thing that I cannot fathom is, obviously, and this question, it does not occur to me, it occurs to every single medical student, and that is, you became a doctor. Why didn't you go for being a super specialty surgeon? Why couldn't you be a vascular surgeon, a neurosurgeon, whatever your passion was? Like you're 42 right now. In another world, in another dimension, you could have been, let's say a super specialty neurosurgeon, right? By the age of 42, and you could have been living the dream, that dream.
Yeah.
Obviously.
Yeah.
So what do you think about that? Like, did it ever occur to you that maybe you could have went down that pathway?
I think there were ample opportunities for that, and there were ample opportunities to pursue that, and it wasn't just that. I think it is a path a lot of people can take, and anyone wishing to take should take it, right? I did try to, by the way. I'll be honest about it, right? But in my heart, it was also the major question was a system, basically healthcare system. Right, because by the time I was finishing my house job, I was mentally done with treating one patient at a time. All right, and living a life which runs from the home to hospital. Right, I started seeing the flaws in system. When you see one patient after another patient, the same diabetic patient with target organ damage, same cardiovascular disease patient with the heart failure, coming in again and again in the ICU, and there is no end to it. Right, then you see life that you're not making impact. If I had become some surgeon or some internal medicine specialist or co-specialist, the part of me would have remained unaddressed. Immature, unaddressed, undeveloped. I would say, right, because I would have only dealt with a part of life which has to do with medicine only. To me, rest of the world was an alien thing. And that would be such a undermining idea of myself, I would say, right? That would have been a very sad thing in my definition, right? That it would have given me comfort. It would have given me life I would want, as for the material comfort is there. But it probably would not have given me the satisfaction of creating a strategic level change with multiple different organizations. Right, because I believe that I'm not trying to, counter the point of view that one should not be super specialist. One should be, right? Why not? Right? To have a comfortable life, to have an amazing life, why not? Right? But you have to decide what you can become contented with. Right? If one becomes contented with that life, so be it. I am more contented with life which offers me diversity in my work, which fuels and nourish and address my curiosity, right? Which does not chain me to particular specialty at all, right? If tomorrow I want to decide that I want to do a startup, say for example, e-commerce startup, because the whole world of healthcare is getting consumer powered, it should not be challenged for me, by the way, right? If I'm a neurosurgeon, I would be handicapped. Literally, I'm speaking. I'd be handicapped trying new ideas because my life, other than that, does not exist, right? So this is what I think that and I'm a firm believer that a person should change his career at least 3-4 times in his life, right? And they should do what they want to do, have fun.
To be more
right?
self-aware, to finally find out what you're passionate about.
Exactly. You know what? If you become surgeon at 42, great. And if you become an amazing entrepreneur at 42, amazing. That's very great. As long as you wanted to be a surgeon or you wanted to be an entrepreneur, depends, right? So it all depends, basically. Because the problem is our society, social pressure, ask us to become a very specific shape person, right? I'm using the word shape. Look at the conformity. When you say shape, it has the dimensions, it has a size, it has everything defined. If you try to push yourself to that particular shape,
You cannot go out an inch even.
and you end up clipping your sideways to fit that shape, basically, right? Shape which is liked by everyone, not by yourself, right?
True. So,
Yeah,
But couldn't you have been like you could have been a surgeon and an entrepreneur? What do you think about that?
it's very well possible, but it will come with a compromise in one of them, right? It would come because not everyone. I don't think so. I'm that talented, but I don't think so. Majority of people would be able to balance it. You know, either it will come with a compromise in a married life, or certain life, or an entrepreneurial life. One of them will suffer. One of them will
Exactly.
suffer, right? Yeah.
But
Yeah.
I must say, you're very talented, mashallah. You're very
Thank you.
inspiring as well.
Thank you.
So my next question is about you're a public health student from Harvard, a doctor, a global shaper, a CEO, a COO, and so much more, right? The things that I've just mentioned in the starting, you're like it's too much for me to absorb personally. Tell us, how exactly do you balance everything, and how do you keep yourself so productive and creative, in the zone with everything that you do?
I think it's one of the most important questions. And by the way, this is the question, even after learning a lot from my mentors, experimentation and mentors, I still ask that question, by the way. And we should keep on asking that question. This is one question. There will never be a perfect answer, but there will always be a good answer. Good answer that fit to your idea about life, right? So let me break the myth about work-life balance, first of all, right? So whoever coined that term, right? I probably don't agree with that term, by the way, because as if there's a separate work and separate life, right?
Exactly. Like
No,
they
so life
they extracted all the passion out of it.
Exactly, totally. Like so the life has to happen after work, right? Okay. And the work is never going to finish. Funny part, right? So the thing is, the day I learned it, I avoid using that term these days because I think it will make my life jinx a lot, right? So it is. So life is happening while we are working. Life is happening while we are working towards it. Life is happening every time. As long as your purpose and passion are together, right? Your vacation and avocation become same, right? Your work and your pleasure become same, right? So your fun, right, and your life become same, right? So seek alignment. I would say rather than seeking balance, we should try seeking alignment, right? So when you seek alignment, you start getting the good quality of each hour. Like think of each hour as a glass. How much you pour water in each glass is the quality of your each hour, right? So the two of those glass would be your work. Two of those glass would be your family. Two of those glass would be yourself. So see which glass is more full, which glass is more empty, and start filling that glass, right? So and keep the glass full. And if you see it's getting empty, start pouring that. And make sure those glass don't collide with each other. At least do that, right? And then you are free to drink. Focus is the important part. When I say glass, I mean focus, right? I learned it a hard way, truth be told. My journey would have been, my tangent of growth would have been much different and even better, I would say, if I had learned to focus early on. I come from a creative side of spirit, right? So we had a natural tendency of a shorter attention span, a smaller focus. So one has to live that way. So focus is the key point here. So it's all about quality in each hour rather than number of hours, right? So work-life balance, this is how it is. Oh, by the way, so there will be no finality in which you can say, okay, yes, today is my day. Today was more balanced, and half of my day was work, half of my day was office, and this is perfect. It's never going to happen, right? So the best day is the one in which you say, that I have lived up to my purpose today, and for each hour, my feeling about that quality of that each hour is that. This is the litmus test for the work-life balance, right? Now, content of your each hour, right, would depend upon how you want to spend it. So, for example, about how I plan. So I learned it like it's been quite a number of years in my medical college, after my medical college, to be very exact. That's when I started doing some time management. After attending that first workshop of Stephen Covey, then NLP, then I did my advanced course in NLP right when I graduated. Right,
Wow.
that's when I started really planning. So I learned the importance of intention and visualization early on. Right, and I still do. Before sleeping at night, I close my eye and visualize my next day. Right, each part of the day vividly. I try to do it as vividly as possible. Right, and also try to embrace uncertainty with it. Right, some things beyond my control, and visualize it and repeat the intention. Then I sleep. So when I get up in the day, I try to recall that visualization, visualize it for a few minutes, 5 minutes, right? And set the intention for the day, then before going to work. So these days I am reviewing my week every weekend, right? So how did it go? And especially with my team as well. For example, these days I'm also working with this organization called IRD, right, which I haven't mentioned. So I'm leading this oxygen therapy. We are scaling up oxygen therapy centers all across Karachi. Just hold on for a second. Just hold on,
Sure.
Yeah, sorry. So those I planned over the weekend. Then I review it over a month. So slowly but surely, it's happening. So visualization start materializing as you do that. That's what initially I did not used to believe in it. I was living life as it comes, and used to only plan a part of the day, more of a priority list. Frankly, that was not really productive. But I learned over the period of time that if you just plan your week and a month and review it every weekend, right, and be kind to yourself while you do so, and little bit, calm down your inner critic so that it does not throw you in anxiety. So that's what I did. Also, I learned power of breathing, right,
Deep breathing.
it's not really deep breathing, power of breathing, like synchronization of your breathing, right? So I think it helps you master literally whatever you want to master, right? If you just inhale and stop your breathing, and your exhale is longer than your inhale, and you do it daily, it helps you master your emotional content of your life, your physiological content of your life. If you control your physiology very well, you can control your emotional quality very well, right? So this is all about controlling your physiology first, then everything comes afterwards. So I'm practicing these days about that. Yeah.
Wow. I mean, this whole conversation that we just had, it's 10x Tony Robbins. It's Tony Robbins' Pakistani version. So thank you so much for these insights.
Thank
I
you.
feel like this is wonderful. This is amazing. And yeah, I totally relate with you because I started meditation 4 to 5 months ago.
Okay.
And it's been an amazing journey. You become more mindful, you become more creative,
Yeah.
and you really get control of your life, right? You get control of your day. It's
Yes.
brilliant. My next question to you is about mental health. So I feel like this is something it's not talked about enough. I feel like if it's even talked about, people focus on the problem always. They don't focus on the solution. Nobody talks about the culture of going to therapy or even accepting that you have a mental health issue. Because let's be very honest, all of us we go through mental health issues a lot of times in our life, right? So, there's lots of stigmas around it. There's lots of stereotypes around it. What's your take into mental health?
My take into mental health is I will use a metaphor of a car here. ठीक है? हम लोग गाड़ी चलाते हैं, ठीक है? गाड़ी लगती है. It is inevitable. I haven't come across a person who has tried riding the bike or a car and has not bumped into someone else's vehicle, even if it is a slight nick, right? Right. So in life, when we are moving about in life, we bump into people and we bump into situations, right? And when our car bumps the other car, not always we can calculate our reaction, right? Right? And not always we can calculate other person's reaction either, right? And
Exactly.
our response is not always prepared, right? So same is the case with our head here, right? We bump into people and situation for which our mind is not always ready. It tries to make sense of it after getting bumped, right? So that's when we also get to know our threshold, basically, right? Problems that we can handle and problems for which we need help to handle, right? Oftentimes I found that we have ego problems, right? And we probably ego problem or also I would say poor emotional literacy about our own self. हमारे कल्चर में इमोशनल लिटरेसी खासतौर पे मर्द हजरात की बहुत ही पुअर है. हमारे यहाँ बता दिया जाता है मर्द रोता नहीं और मर्द को दर्द नहीं होता और मर्द जो है ना सब लाइक मैन ऑफ स्टील है ना बस, ठीक है, राइट? अब that's what it is. Not in our culture, it's like globally I would say. अब उसकी वजह से एक तो numbness और dumbness दोनों साथ आ गए. I'm sorry to use that word because we are dumb about our own emotional content. Right?
Exactly. 100%.
How sad is that, right? So and when we bump into a situation and people, we try to handle it, but we fail to call for help when it is needed. The trouble starts happening at that threshold between ability to handle that situation versus the need to call for help when the situation is such that one cannot handle it, right? That's where the ego traps comes in often, that you can handle it. So this is what my take on mental health. I think a counselor hona chahiye, and we should all have a mentor and a counselor with us, right? Just like a friend with us, because in this is just like in 2020, we are trying to survive out of 2020 with COVID-19 and the socioeconomic situation like globally, right? A lot of people would need help with that, for example, right? It is not going to be very simple. People have lost their loved one or perhaps themselves in a situation where they find it difficult to handle. So that's when they should call for help and get help. So mental health, it has to do with awareness of self, awareness of boundaries of self, about at what point we need help, and not be shy from calling from help, because otherwise it can be too late. The damage to mental process can be permanent, right? The ability to think straight can become difficult to time if one does not call for the help. So this is
Exactly.
So yeah. So but it's for all the genders. I have a feeling that in men, most of the script in Pakistan or in a society which are conservative, toxic masculinity has made it really worse. The call for help.
So true. Thank you so much for sharing this insight, Dr. Kamran. My next question, since we're a little short on time right now, and it has been a wonderful conversation. I really wanted to go along, and but Instagram won't let me. So, you being an expert in the health show, it's very important to ask you this, and that is, if I want you to give us 3 key insights for a British sleep, diet, and exercise routine.
Okay, so I may not be a very perfect person to ask this question, by the way, given I'm slightly a bit overweight here. But I think I can give example from my own experience of changing diet. I've lost. I was 105 kg. I'm now 98 kg. Right. I started. I used to walk fairly frequently or consistently. Nowadays, I'm not able to. I only get out once in a week or maximum twice in a week. But with diet, I think 70% is our diet, right? If anybody wants to lose weight, one has to improvise with the body type, actually, right? Oftentimes, we don't respect our body, right? and that's when the things become. That's when things become difficult. So I think the best diet is with any diet with less carbohydrates. With lesser carbohydrates, right? And a bit of a lean meat. That would be the right diet, and that would probably keep person relatively safe from disease, because diabetes is very prevalent in our society. As for the exercise, so I was reading the research on the exercise. So if a person is not overweight, if the person is as smart as you are, right, perfect weight, right? So best exercise is like doing cycling for good 30 minutes is good enough twice in a week. If stationary cycling or any other cycling, because what really happens is sends a message to your body about losing fat, like losing all those fat that we accumulate.
Exactly.
And the process of losing fat becomes longer. It goes on a longer tangent than a shorter tangent. So if you're just following that consistency, So this is what I think is critical. But I would suggest a lot of people, including myself, in the past, when I started dieting, I had a difficulty in being consistent. But I've learned over the period of time to start taking baby steps over the long period of time. Make it easier for yourself. If you think of perfection,
enjoy the process, perhaps.
Yeah. If you think of perfection from day one, then you make it difficult for yourself to follow through.
There's no such thing as perfect eating.
Yeah. A lot of people try to achieve a big goal in a shorter time. They only achieve the part of the goal, but they then leave this half of it.
Because they're impatient, right?
Because also energy gets consumed. The energy which should be preserved for the longer tangent
And what do you think about sleep?
Sorry?
So what do you think about sleep?
Sleep, yes. Sleep is the most precious thing, actually. Why I say precious? Because it is the time where all you are yourself with your dream. This is where you get so the best idea. My idea of sleep is uninterrupted sleep for 8 hours. Right, 8 hours is a must. Especially for the more older you are, the more you try to catch up with your sleep. Actually, right? Especially the two phases in life. In a puberty time, when adolescent time, the sleep needs to be completed, and when you're grown up, like when you're late 30s or early 40s, sleep have to be around 8 hours. Because this has to do with the maintenance of your body. In adolescent time period, it has to do with growth hormone, right? But unfortunately, because of all this, mobile phones and the blue lights and the mobile phone, it disturbs our melatonin, right? System, and our sleep pattern can become very disruptive. Also, a lot of coffee intake can disrupt the sleep cycle. Right? I see youth suffering from insomnia these days, right? And because of their quality of life, quality of life becomes very poor over a period of time. The attention span becomes lesser and lesser over the period of time. So I think 8 hours of sleep, uninterrupted sleep, fairly frequent sleep. I think diet, exercise, sleep और लाइफ के प्लानिंग में सबसे ज्यादा की कंपोनेंट है कंसिस्टेंसी का, ठीक है? Even if you are failing to achieve a lot, but if you maintain consistency in a longer arc, you will be successful. That is what is the key here, actually. Exactly. In a longer arc, you will be successful. So exactly. Sleep is or somebody commented here that mental health depends on a good sleep. Absolutely, I would say. Right? If a person is not sleeping regularly with a good quality of sleep, तो क्या होता है कि वो threshold जो होता है temperament का वो बहुत नीचे चला जाता है. Person become easily irritable, and lack of focus can be a problematic. As opposed to the person who has completed his sleep, is fully aware and if for example अगर आप exercise और meditation नहीं भी कर पा रहे हैं, आपकी अगर नींद अच्छी हो तो आप ज़्यादा mindfulness के साथ काम कर सकते हैं. Yeah.
Exactly. So we have a question, and that is, what if somebody has interrupted sleep?
Yeah, I think अच्छे खासे लोगों की interrupted sleep होती है, खास तौर पे mothers की जिनके छोटे बच्चे होते हैं, right? उनकी बड़ी बहुत ज़्यादा interrupted sleep होती है. So there are interruptions that you can avoid. There are interruptions you cannot avoid, unfortunately. ठीक है? So interruption जो छोटे बच्चे होते हैं, like the neonates or younger kids, it's very difficult to sleep. So I often, as a doctor, मैं suggest ही करता हूँ कि जब बच्चा सो रहा हो, कोशिश करें बच्चे के साथ ही सोएं उसी वक्त. बच्चे के sleep timing को अपने sleep timing बना ले तो you probably be able to catch up some sleep. Also, अगर बच्चे हैं साथ में और घर में कोई भी है, हस्बैंड है या भाई है कोई भी, तो किसी एक शख्स की वीकेंड पे जरूर ड्यूटी लगा दे कि बच्चे संभाले. ठीक है? आई होप कि ओवर द वीकेंड या वंस इन अ वीक पॉसिबिलिटी हो जाती है, भाई बहन, हस्बैंड, मदर, किसी को के पास बच्चे को बेबी सिटिंग के लिए बिठा दें. आप खुद अच्छी सी क्वाइट अ गुड क्वालिटी ऑफ स्लीप एक साथ लेके आप उठ जाओ. ये बहुत जरूरी है, खासतौर पर मदर्स के लिए जिनके छोटे बच्चे हैं और पूरा वीक गुजर जाता है. बच्चों को का ख्याल रखना और केयर करना can be an overwhelming experience as a matter of fact.
Exactly.
And it's just sleep deprivation also बहुत ज़्यादा होती है. Often I see mothers on a very low threshold when it comes to kid. Is only because that kids, raising kids can be an overwhelming experience, and on the top of it, poor sleep can be a disaster to it. So I often ask most of these mothers that try to catch up with your sleep. Your sleep time should be with your kids' sleep time. If not, then at least make sure somebody babysits at least once or twice in a week that you catch up with your sleep. And
exactly.
Sort of,
So we're very short on time. We just have like 2 minutes. So I just want to ask you this final question, and that is the most exciting question. And it is this. Dr. Kamran, if you had all the money in this world, if you had all the time in this world, and if you had all the energy in this world to keep yourself healthy, what would you do?
I think I would go and I would do few things that I have been trying to do for quite some time, which is I'll go set up my space for first of all, I'm going to spend time with my kid. Number one, the first thing first. I still feel that I'm not able to spend time with my kid and my wife as much as I wanted to, right? And they deserve more of my quality time, admittedly. That's the first thing I'm going to do. The second thing I'm going to do is I'm going to set up my space for writing. I'm into writing. And I used to do screenwriting as well, which I haven't mentioned here, for movies. Yeah, one of the movies also got made as well with this Indian American author. It's on IMDb as well. Yeah. So yeah. Anyway, so we'll talk about those screenwriting some of the day, perhaps. So I would set up my space for writing. I'll start writing. There's lots of movie ideas that I'm going to do. And third thing I'm going to do is to set up a structure to help people, right? To help people reach their potential, basically. Nothing excites me when a person reaches from point A to point B from sheer hard work and struggle. This excites me. This inspires me a lot. This is my daily food of my mind, to be on the YouTube searching for stories, right, in which people have reached from point A to point B from sheer struggle, sheer smartness, right? So this is my daily.
That is also the whole point of the health show. Talking about health and wellness. The other major part of this is the life journey that I really value. Like I cannot emphasize and stress this enough. I don't know if you can see my excitement and arousement that I just had, listening to you. My everyday revolves around this as well. Like this is the major part of the health show, because I want to invite people who've done great stuff and they share it with me. So, not only do I learn, not only do I have mentors like you every single day,
thank you,
but I can, provide this valuable access to everyone who wants to use it.
Absolutely. I'm so excited to be part of it. I was going through the content that you have posted in the past.
Thank you. Okay, so we are about to end.